This is Bringing Better Health to Life, a program brought to you by Conway Medical Center. I want you to meet my guest. This is Dr. Winston McIver, and he was raised in Conway. Left for a while and then came back. He is with Waccamaw Primary Care. Glad to have you here with us.
Glad to be here this afternoon.
Tell me your story. Tell me a little bit about you and how you left Conway after school, and where'd you go?
Well, after graduating from Conway High School, I decided I wanted to go to college in Atlanta. So I chose Morehouse College in Atlanta, and I was there. And then I left, after graduating from Morehouse, I went to Meharry Medical College in Nashville, Tennessee, the fourth person in my family to go to school there. And after that, I did a fellowship at Case Western Reserve, and then I did my residency and internship and residency at the University of South Carolina.
At what point did you decide you wanted to be in primary care? Did you ever think of another specialty?
Well, when I first went to medical school, I was interested in pediatrics, but then I realized there's a difference between loving kids and wanting to take care of them all day long. So I decided that primary care, family medicine was more suited towards what I wanted to do, in addition to doing sports medicine as well.
And obviously you take care of kids from 13 up.
Exactly. I take care of 13 up, and it's been very interesting because now I've been back home enough to see some of these 13-year-olds now get married and go on and have families of their own.
And bringing their kids back in when they're 13.
You're right.
But you're not that old yet.
Not quite, not quite.
Now you also, I understand, work with the Coastal Carolina University students and athletes.
Exactly. When I first moved home, President Engel asked me if I would help get the Student Health Center started at Coastal Carolina, and I did so along with some other people on campus. And additionally, I was working with the athletic department likewise, and now I'm considered the athletic medical director, so I deal with all 400+ student athletes dealing with issues ranging from high blood pressure, diabetes, to depression, anxiety, and any other primary care sports issues.
And obviously they're the same kind of issues that you deal with families everywhere.
Exactly, exactly.
Let's talk about the person who comes in and, you know, they're just, some people just think, I'm not feeling well because, oh, well, I'm getting older, I've got a job, I've got this and that. A lot of people are just out of energy and they don't know why.
Right. Well, one of the big things is just kind of do a risk assessment on the patient. It primarily deals with getting a good thorough history and physical on the patient, find out what symptoms they're having, look for different signs during the physical examination, and then decide what appropriate blood work and studies need to be done. You know, often, you know, people ask me what's the hardest part about my job, and it's usually having people change bad habits. Sometimes habits are hard to break, but a lot of times if we were able to change some of those habits, we would feel better, and additionally going to the physician to be seen.
Let's just talk for a moment. You brought it up, bad habits.
Right.
What are some of those bad habits that we all need to say enough?
Well, some of the bad habits are lack of exercise. I know we all get busy, yours included, but we have to understand that just 30 to 45 minutes, 3 days a week can be enough to help increase our quality of life and increase our life expectancy. Additionally, eating well, exercising regularly, eating well, and listening to your body.
We all know that there's way too much smoking going on around here as well.
Exactly. Being in the tobacco belt, you know, it is very common in this area. Lung cancer and other associated conditions related to tobacco use, ranging from prostate cancer, lung cancer, to other kinds of cancers that are related to it. I encourage patients who smoke to get regularly check-ups, chest x-rays, blood work, and evaluations on a frequent basis.
I guess, too, that you have a lot of people who come in to you and they don't know their family history.
Right.
Either they've never asked or they
Right.
didn't know some of their family members. But
Right.
just how important is that?
It's very important. I've found, you know, one thing is that a lot of people don't discuss their family histories, and that's very important, particularly in what I do in primary care family medicine, because that can unlock a lot of keys to help break in some of the cycles of disease.
Speaking of disease, when we come back after the break, we're going to talk about diabetes, hypertension, and a whole lot more. Don't leave us. We will be back.
The Conway Medical Center website provides visitors with a comprehensive resource for their health and wellness inquiries. From our homepage, just click onto Search Health Topics for direct access to the HealthWise knowledge base, where you'll find over 5,000 topics about health conditions, medical tests and procedures, medications, support groups, and everyday health and wellness issues. At Conway Medical Center, we know that better informed patients make better health decisions.
For over 50 years, it's been our mission at Garden City Furniture to offer our customers quality home furnishings at an excellent value and to provide personalized service that is second to none. You'll feel at home at Garden City Furniture on 17 Business in Garden City.
We're talking with Dr. Winston McIver of Waccamaw Primary Care, and we've been talking about some of the services that he has. And I just learned during the break that you offer a lot of services that most primary care doctors do not.
Exactly. What I've found is in the 15, 20 years I've been doing primary care medicine that a lot of times when you let patients know there's certain services you want to get done, they may not go and get it done. So if you offer them in-house, a lot of times the compliance goes up tremendously. We offer nerve conduction studies, checking patients who have issues with nerve pain, discomfort, numbness, tingling. Additionally, we offer cardiovascular services, which do screening assessments for aneurysms, blockage in the carotid arteries, any kind of palpitations where we can do echocardiograms or ultrasounds of the heart as well. We also do some pulmonary testing in the office as well, checking for any lung conditions or lung abnormalities in patients who may come in with some of those symptoms.
When you left Conway and then returned, did you return because you knew how desperately you were needed in this community? There were, I mean, we're certainly number one or number two for heart disease, have a lot of allergies. We have problems.
That was the primary reason why I came back. I knew that there was definitely a primary care shortage in South Carolina and South Carolina in general and Horry County specifically. So, you know, I figured, you know, I wanted to go someplace where I'd be needed, where I'd be in demand, and where I could give my services, and I thought no place better than home.
We know that diabetes is very prevalent here as well. Yes. How does someone know that they need to see a doctor because they could be a diabetic?
Well, often they may not have any signs or symptoms. However, in diabetes, there is a syndrome called the 3 Ps: polydipsia, meaning drinking a lot, polyuria, excessive urination, and polyphagia, where the appetite is just tremendous. And any of those signs would be signs or symptoms of diabetes. Additionally, cuts on your arms or anywhere in your body really where it takes a long time for it to heal could be a sign that the person's diabetic. Or recurrent skin infections, likewise.
A lot of people think if they're diagnosed as a diabetic, then automatically they're going to have to take insulin, their whole life is going to change, but that's gotten better over time.
It definitely has, and I'll tell you a story that I found. When one of my first patients, when I got home, thought that the natural progression of diabetes was an amputation. And I had to make them understand that that's not a natural progression, it's actually an abnormal advancement of the condition, and that if managed well, treated well, those things don't have to happen.
Hypertension, touch on that a moment.
Very important. Hypertension is the link to good health, kidney function, heart attack, strokes are all related to hypertension. Dietary indiscretions are generally a big part of hypertension happening. Getting a well-balanced meal, plenty of water, cutting back on the processed foods, cutting back on the soft drinks as well can also decrease the sodium intake, which in turn can lead to hypertension.
I bet it's annoying to you as a physician, Dr. McIver, to recommend to your patients that they come in once a year, but then they're healthy and they feel fine and, oh, I'm not going to go for my regular checkup. But they don't realize that you could find something in that office, especially with all the added services that you offer, that could be life-saving.
Well, I try to stress that you know, a lot of times the body, you know, will not tell you things early on. A lot of times, a lot of these conditions we're talking about are late developing conditions as far as knowing that there's a problem. So being proactive, checking labs, regular checkups are very vital to cutting off a problem that could be around the corner.
And finally, the whole thought of a primary care physician is very appealing to me, because for people to come in with their 13-year-old children and up, and then if you see that the father has had heart disease, then you're more aware to watch this child as they progress.
That was one of the attractions for me for primary care family medicine, was that I can establish relationships with the whole family. And it's amazing how now, you know, I've been doing this long enough to see, you know, some of these young people now become adults.
Yeah, you said that earlier, and that just blows my mind that you've been in practice that long, because you look so young.
Thank you.
You know?
Thank you.
So one more question. When you are recruiting patients to the team, what do they need to come to the office with? Do they need to come with former records? Do they need to come with family history? What do you recommend that they bring with them?
Well, coming with former records would be helpful. However, if you don't have that, we'll just get you to sign a release and we can get the records sent to us. Any additional information, we get that on the initial intake or the assessment. There are some forms that we have when you first come in or when you're waiting in the lobby that we will have you fill out, but we go through all those extensively when you come in the office, so that way we can understand a family history, so that we can know where to go.
Thank you so much.
You're welcome. Thank you
Dr.
for
Winston
your time.
McIver, thanks for being with us here with Conway Medical Center.
Thank you. My pleasure.